Welcome, everyone. Thanks for joining us for today's webcast. My name is Grace Zhang. I am a research manager at the Water Research Foundation. Today, we're presenting the Foundation Project 4664, Customer Messaging on Opportunistic Pathogen in Plumbing System. Well, as many of you know, the Water Research Foundation had hosted a three-part webcast series on Legionella last year. If you were not able to attend the live webcast at the time and wanted to access the webcast, the recording and slide, please visit our resources page on the Foundation website. Well, I would like to give a brief background why Foundation funded this project as the first year of the Focus Area Program. In 2014, our board approved the waterborne pathogen focus area. Then we funded a project to create a multi-year research agenda and prioritize the research idea for this focus area. Majority of the workshop participants and the technical advisory committees agreed that developing effective communication strategy about opportunistic pathogen in building plumbing system was the #1 priority for the water community need. So today, we're pleased to share the outcomes of the first focus area project. Foundation also funded 2 other projects on opportunistic pathogen issue under the focus area. And these projects are ongoing, and we'll share the outcomes of the projects when the projects are complete. Well, as I mentioned, the project final report is now available on the Foundation website. In addition to the report, we posted 2 fact sheets, an FAQ, and compiled national and international guidelines for Legionella control. We also separately posted Appendix G, which provide a sample text for the website and a bill insert and other communication pieces that were developed by the project. These materials are open to the public, so please feel free to visit the project page and download and use them to suit your need. Now, I would like to introduce our speakers today. Our first speaker is Dr. Jennifer Clancy. Jen is Executive Director of Environmental Science and Policy and Research Institute. She has worked on the Legionella and Legionella disease since 1980, both in clinical and environmental research and testing. After over 30 years working with a drinking water utility on a host of water quality microbiologist issue, her current focus is on the water quality degradations in building and a way to manage the opportunistic pathogen, including Legionella. Jen is the PI of Project 4664. Our second speaker is Mrs. Samantha Viegas. Samantha is the president of SEBI PR LLC, and she is as an award-winning communication strategist with more than 25 years of experience in providing strategic communication counsel for water, energy, and resource management. Sam has played a key role in the development of several AWWA publications, including guidance documents on the communicating about lead service line and the guidance document for distributing the ECCR. Sam is a co-PI of Project 4664. Our third speaker is Dr. Mark Chevalier. Mark is principal and manager of Dr. Water Consulting. He had worked for 30-plus years with American Water, and he currently serves on the Water Science and Technology Board for the National Academy of Science, and he is a member of the NAS Legionella Work Group. He is also the co-PI of a project. Well, just a little housekeeping items before we get started. Today's webcast will last 90 minutes in total, and then this webcast is being recorded. The recording and PowerPoint slide will be posted on the Foundation website. If you have any questions during the presentations, please type them into the question box on the lower left of your screen. We will have a time for the question at the end. Immediately following the webinar, you will be directed to the follow-up survey. Please take a moment to answer those questions. Without further ado, I'll turn the time over to the Dr. Clancy. Jen, please take it away.
Okay, thank you, Grace. Good afternoon. Welcome, everybody. So just a little bit about who our entire project team was here. You heard from Grace, who was our manager. And our PAC members were Gary Burlingame, Paul Rochelle, Allison Albert, and Melissa Elliott. And then the team members, besides myself that are on the phone today, were Sheldon Masters with Corona Environmental, American Water, Zia Bukhari, and John Paul Anderson. And then we had 12 participating utilities, as well as CDC and the Philadelphia Health Department. So our project goal, we had 3 project goals, but our overarching goal was to conduct research so that we could develop guidance for utilities to be able to communicate with their large customers. So really the building owners and managers and those who operate building water systems. And we wanted them, the goal of the project was to provide materials so that they would understand the issues that are related to opportunistic pathogens and what risk they pose within building water systems. We also wanted to be able to provide customers with steps with information that they could take to reduce or minimize pathogens growing in their plumbing systems. And then thirdly, to develop clear and simple messages and communications materials that water utilities can use for these communications. And that covers 2 aspects. We wanted to look at proactive communication about pathogen growth in building water systems. So this is when there's not any recognized problems going on. But then to have materials available in a reactive situation where there's either been a pathogen outbreak that might be associated with that building, or even in the case of not an outbreak, but maybe an isolated case. So we had 3 project tasks. Our first one was to identify our target audience, look at routes of communication to the audience, and messages that we would develop that were appropriate for the audience. And these were based on a series of interviews, work groups, and literature review of existing guidelines. And then this task culminated in an expert workshop that we conducted at American Water with our entire team. The second task was to refine the messages, routes of communication from task 1 using the workshop feedback, and then to test the messaging through pilots in 3 different areas of the country to look at how effective this communication campaign would be. And then the third was based on the feedback. We developed this into our final report, and then that's what we're presenting to you today. So one of the things we saw at the outset was some reluctance to communicate about Legionella. So some of the comments were, if there's no issue, why stir it up? Why are we talking about this now? This, if you recall, this was at the time when the lead issue was very prominent in the country. A lot of utilities were dealing with lead. They were having questions about lead from customers. So now why are we bringing up something new? What's this Legionella about? The second we heard was the topic was too complex. It's on the building water side. There's a lot going on with it. There's a lot not understood about it. So it was just too confusing. There was some desire from management to keep information private. This relates into legal issues, people feeling that they might be more exposed legally if they were proactive in talking about Legionella and Legionnaire's disease. There could be inaccurate media coverage because it is a complex issue, and then the media might get something wrong. That could lead to bad press, overexposure. Like any topic, there are differing expert opinions, so that was maybe a reason not to get involved in this. Again, current level of knowledge not sufficient. And then varying standards for premise chlorine residual. So, if someone is saying, well, there should be a certain chlorine residual, but then there's certainly differences across the states, and there's not specifically anything in buildings. So there were just lots of unknowns and lots of concerns about why we should even get into this topic at this time. So let's talk about why we think we should do this. Why should we care and communicate about it, which was the project goal and our scope. We're going to talk about contacting the target audiences. We're going to provide you with information about the message materials, and then talk about what the response to the messages have been. So number one, why should we care and communicate about Legionella? So this graph is busy and it's colorful, but what you're seeing on the y-axis is the number of outbreaks, and these are outbreaks related to, associated with drinking water, 928 outbreaks in the U.S. from 1971 to 2014. And along the x-axis, we're looking at the years. So there are many things that can cause outbreaks, microbial as well as chemical disease. These are broken down by different types of bacteria, viruses, parasites. But what I want to draw your attention to is the cases of Legionnaire's disease. So these are represented in black. It says bacterial Legionella. And if you look in the late 70s, there are tiny bars there. But as we move along, and especially when we get to the 2000s, you'll see that Legionnaire's disease is the most common disease that we're seeing here in terms of numbers of outbreaks. So that right-hand part of the graph, you see there, it's all black, and that's where we're seeing the increases in Legionnaire's disease in the U.S. The next slide is just a cleaner version of that. It's represented a little differently. The x-axis are the reported cases, and you see that they've increased 5.5 times from 2000 to 2017. The y-axis is the number of cases per 100,000 population. So Legionnaire's disease is clearly on the rise in the United States, and it's not something that the water community can ignore. So just a little bit about what Legionnaire's disease is. It's an acute, Legionnaire's disease itself is an acute pneumonia, sometimes fatal. There's another form called Pontiac fever that's kind of like a cold. You wouldn't necessarily even know you had Pontiac fever, and it's self-limiting. Legionnaire's disease cases are about 8,000 to 18,000 a year of reported cases that CDC recognizes, and the disease peaks in the summer. About 4 to 5% of all pneumonia is caused by Legionnaire's disease, and the mortality or the death rate is 5 to 30% of people who contract Legionnaire's disease. And this is a very high rate of an infectious disease that's treatable with antibiotics. And the infection itself is acquired through inhalation, so breathing in aerosols that have Legionella bacteria in them. So that's the little cartoon that you're seeing on the side. We're looking at transmission comes from water. The reservoir there is a reservoir where the organisms will be growing and amplifying and proliferating. So it's not a drinking water reservoir per se. It's a reservoir, for example, in a building or in a cooling tower that will generate aerosols, and then they'll be released. They'll be inhaled by a susceptible host. That's the little person at the bottom right. And then you see up top right is the host that has lungs infected from Legionnaire's disease. So where does it come from? It's an environmental organism, so you can find it in lakes, rivers, groundwater. It's found in soils. And we also find it in engineered water systems. So that's drinking water, reclaimed water, hot water systems, cooling towers, hot tubs, decorative fountains, misters, any type of thing where it can grow in an engineered water system. That's where it will grow and proliferate and potentially become a problem that could lead to disease. So this slide I call the new water paradigm. And what a new paradigm is, as it's defined there, it's a set of beliefs that replaces another set which is believed no longer to apply. And I think this is where we are at this point in the water community. When we look back at the Safe Drinking Water Act, that was designed to provide safe water to all customers. And what we were looking at that time, safe water, was really looking at fecal pathogens, enteric pathogens. The surface water treatment rule dealt with Giardia. Long-term 2 rule dealt with Cryptosporidium. So we were talking about what the rules were designed to deal with were fecal contaminants and fecal pathogens. So that was what we were thinking of in terms of safe water. But we now know that water that's safe to drink, that meets all of those regulatory requirements, may actually not be safe to breathe. And we also need to recognize that the water the utility sends to its customers is often not what's found at the tap in the building. And that's because the building is its own ecosystem, and water quality, both chemistry and microbiology, changes once the water gets into that building. And the building design and the operations within the building exerts its own effects on water quality. And if you think about this, every building is actually a dead end. So that is where the water goes. It stops there until it's used, and it can change dramatically over the course of time in that building. So I think this is the new water. My new water paradigm is something we need to think about in terms of how we manage water all the way to the tap, even when it's out of the direct control of the water supplier and it's in the building. So I'm now going to turn this over to Samantha, and she'll give you the second piece of the workshop.
Thanks, Jen. Can you all hear me? I guess you won't tell me, but I'm going to keep going until someone tells me it's not working out. You'll hear us talk about that resounding message of that the water quality can often and does change once it passes through the meter to a home or a business. Here are some other resounding themes from the research in terms of the customer education. Not all customers may be aware that Legionella is a problem that primarily resides within the premise plumbing, not coming in on the water, but coming as a result of the water quality within the building that they're in. The greatest issue is for the C&I group, the commercial industrial group, and within that is healthcare buildings at the top of the list. The CDC has a toolbox for risk management. ASHRAE has the Standard 188 and the Legionella Water Management Plan. These are key tools for the C&I group and healthcare group. And, kind of building on what Jen said, water utilities are a part of this. Even though, your responsibility ends at the meter, customers look to water utilities as the authoritative voice on water issues. So when the questions come in, you've got to be prepared. So let's dive right into who we need to be talking to and about what and how we reach them. These are the target audiences for talking about Legionella, and we list them in order of risk. So Legionella is more likely to be a problem the more complex the building system is, and the more vulnerable the audience. It's those, or the tenants. So it's those two pieces. And that's why we list them in this order, with healthcare facilities first and single-family homeowners last. It's not to say that single-family homeowners shouldn't pay attention. They absolutely should, particularly if they have occupants who are immunocompromised. It's just more likely to become an issue when you have a more complex building plumbing system and you have tenants that might be, let's say in a hospital case, that are immunocompromised. So before I get into too much detail about reaching these audiences, you're probably wondering, how do we know these are the right audiences and strategies? And Jen kind of touched on this in the intro. We know because as a part of the project, we did extensive research and outreach to determine that. So as you can see, we spoke to many utilities all over the country, large and small sizes. We spoke to the trade groups that have relationships with the facility managers. And last, we spoke to and surveyed facility managers themselves. So here's a summary of the findings of which strategies are best for reaching which of the target audiences, and I'll spend the next several slides giving you some detail about each of these. What you see here is single-family homeowner on the upper left, the C&I customer to the right. Third, you'll see hospital or healthcare customer, And then that fourth group I call local community group or affiliated group, and I'll explain each of these. So the hospital or healthcare center, for the facility manager at your hospital or healthcare customer, it's personal outreach to the facility manager in charge there. So if you don't already have a relationship with a facility manager at a location like this in your service area, there are many reasons beyond Legionella even that this would be beneficial. Think in terms of planned outages or boil waters. So the idea here is to take time, if you haven't already, to identify this person or team of people and reach out to them, introduce yourself, and get the lines of communication open. In a moment, we'll share with you what you'll want to relay about Legionella. In addition to your own direct contact to these folks, consider that they are likely members of the Society for Healthcare Engineers. This organization has chapters throughout the country, and it's worth reaching out to the one closest to you to see if there are opportunities to submit an article for their membership newsletter or to conduct a briefing at their monthly meeting. The idea here is you're reaching out to them directly, and then you're also reaching out to a group with whom they already have a relationship with, a trusted relationship with. So you're trying to catch them in two different ways. Everything I just said about the facility managers in healthcare stands for facility managers in other types of buildings. While their trade group may be different, it could be the IFMA, the International Facility Managers Association. So as before, you want to be opening the lines of communication directly to these individuals via email or a phone call, and seek opportunities through the local chapters with the IFMA. Note that your standard ways of communicating with customers, such as the bill insert, social media, local media, all these routine ways are not likely to reach a facility manager. So the personal outreach is key. Note that these folks may also not be employed by your actual customer, the occupant of the building, but rather a contracted agency. So either way, you need these relationships, and like I said, there's reasons beyond that of opportunistic pathogens like Legionella to do so. For the single-family homeowner or townhome owner, anyone that you have a direct relationship with, you know what works best, how to reach them, as you've probably been doing that for some time. So whether your e-newsletter that you're sending out electronically, your social media, a bill insert, or what have you. Also consider hyper-local publications, things like community newspapers or a homeowners association or a civic association newsletter. Also, many of you are probably at the start of gathering data for your CCRs, and this poses a fantastic opportunity to begin the Legionella conversation with your customers. And later we'll share the messaging for that, as well as other strategies that I mentioned. So this last group is what I call the local or affiliated groups and organizations. These are any local, nonprofit, government, or community groups that have established relationships with your customers and are somehow, if even tangentially, related to drinking water health. This is a relationship building exercise and a small part of any water utility's comprehensive outreach program, again, for reasons that go beyond Legionella. So what you'll do is take the time to identify which of the following on the next couple of slides might exist in your service area and begin those conversations. Maybe they have a monthly meeting you can say a few words at, or submit a newsletter article, or connect with them on social so you're sharing each other's info. The more groups with similar audiences and concerns that you can engage with, the more successful you will be in that engagement. So who are we talking about? Here is a list that was brainstormed during the expert workshop we hosted with utilities and members of local public health, as well as the CDC. And I classified them in general groups. So, school systems or private school systems and daycares, If there's a local child care association, to reach children, folks that work with children. The elderly, if you've got a local chapter of AARP or nursing union or local nursing homes or assisted living. Any of the technical and trade organizations that might exist chapters in your area. There will be national chapters of all of these where you can find their local, but that's the key, is finding out who's in your area that you can reach out to and share that messaging with. Oops. And here's a couple more: government, folks in healthcare, housing, and even legal. Okay, now I want to shift gears share with you some of the sample materials that we provided within the report for reaching these groups. This is a sample bill stuffer or billing insert. The messaging in this piece and the suggested subtitles and breakout text can be lifted directly into your own layout and designs to match your utility's brand. We provided several sample materials. I'm just going to go through a couple more of them now. Remember, I mentioned the CCR text, and you're probably getting ready to pull that together. This is a perfect opportunity to start talking about Legionella. Note that the first message here is about the shared responsibility. We can't emphasize how important that is to say. Obviously, you can't get across in the small space in the CCR everything you need to. So it is going to be important that you have a web page within your utility's website for Legionella. How much you say at the website is going to be up to you, and Mark will discuss what's available. We're going to give you more than you ever would need that you can customize for your own website. But the point of the CCR text is to alert them to this issue as something to consider and think about, and then give them a place to learn more. The key piece for social media, and I know many of you are already involved with your utility, you're engaging with your customers on social media. But the key piece with social media is relevance. The best, most successful posts are tied to what everyone is currently thinking or talking about. So while these messages can be used anytime, they will be particularly effective when Legionella is part of the national news cycle due to an issue or a sickness reported somewhere nearby or even nationally, or two, when you are promoting water quality. So some of these messages you'll see, I'll read to you from the slide, just getting folks thinking about it in terms of water quality. Did you know that Legionella accounts for 66% of all drinking water outbreaks in plumbing systems? Learn more. Another one might be, you have a role in maintaining the quality of water inside your home. Learn more. And then the final one as an example of, when it's happening. Legionella was in the news today. Find out whether your home or business is at risk. And that one I like a lot because it's got the relevance piece. It's what people are looking for and thinking about, and you're there with the timely information. So when it comes to the messaging, as Jen mentioned, we split these into proactive, or what I call peacetime messages, and reactive. Beginning with the proactive messages, these are applicable to all audiences. And our guidance for you is to focus on what is Legionella, how it becomes an issue, the risks, and then, of course, the preventative measures to take. When we get to audience-specific messaging, for the facility managers, we offer the messaging for reducing the risk of these pathogens, which is primarily the development of the water management plan and following the CDC, CMS, and ASHRAE guidance. I'm not going to spend time reading everything on the slide, the messaging that we're providing that's in the report that you can download, but just to give you a sense of what that content is. Okay, and so the CDC says that facility managers should be developing a water management plan, and here's just an example of who that should be developed for, what kind of entity, what kind of structure should have a water management plan. Audience-specific messages for facility managers include the idea of the shared responsibility between the utility and the facility manager, and then the fact that you're available to provide support. There's some things that you may be able to do to be of further assistance to them. For homeowners, audience-specific messaging also includes the shared responsibility and then details of the specific actions they can take. Whereas in the case of the facility managers, we're going to direct them to the CDC or the ASHRAE guidance. For homeowners, we have a whole slew of guidance that is specific within the various types of fixtures in the home where Legionella growth may occur. You'll see when Mark discusses the website portion how detailed we get with guidance for minimizing the risk of Legionella proliferation in a variety of the household appliances and systems. For reactive messaging, what happens after an outbreak, the messaging shifts from risk prevention to how exposure happens, the effects of exposure, and what to do if exposed, which is really just to direct them to see their doctor. For facility managers, it's important that they be directed to the CDC and ASHRAE guidance, and then make sure they know what services you can offer for support, as well as what other community resources are available. Our findings show that local public health offices will likely take the lead on messaging if such an issue would arise in your community. So it's all the more important that those relationships between you and your public health office, for example, are developed in peacetime so you can be of service when needed. Now I'm going to turn things over to Mark, who is going to discuss the website and the messaging.
All right, thanks, Sam. As we mentioned, the website can be a cornerstone for the information that you send out to your customers, and can be a reservoir which you contain the information and direct your customers back to. So it's a critical piece. We recommend that the website have messages for these different types of customers that have been discussed. For example, for homeowners, we emphasize that homeowners are typically considered low risk. They are not the large, complex buildings that tend to have the outbreaks of Legionnaire's disease. But nevertheless, only about 5% of the cases that Jen showed in the incidence of cases can be attributed to outbreaks. So there's other sources of Legionella in the community that are not known. And so it may be prudent that homeowners, particularly if they have people that are in the category of being susceptible to Legionnaire's disease, the elderly, people with predisposing diseases, smokers, for example, may want to take additional actions to manage Legionella occurrence in homes, even though the risk there is low. And so, for example, there are procedures available for cleaning shower heads and faucet aerators already. That is should be guidance that utilities should be providing to homeowners anyway, to routinely clean faucet aerators. Now can be done in the context of Legionella management. Hot water temperature is a key factor, and in fact, the website material goes into, first of all, knowing what type of hot water heater you have. Electric heaters, because the element is not at the bottom of the hot water heater, there's typically a little space underneath for sediment to accumulate, and because hot water rises, the water at the bottom of the heater and in the sediment can be cooler than water in the rest of the heater, and that can be an environment which Legionella grows. And so there are recommendations to, particularly if you have electric hot water heaters to drain and clean that sediment from the hot water heater. There's a recommendation to have a licensed plumber do that because that could put the homeowner at risk from handling hot water. And so but there are procedures there to do a hot water tank flush. And there can be water treatment and filtration. This becomes fairly expensive, so it would only really be for a homeowner that was really high at risk. But there are filters that can go on to shower heads, for example, if there was a concern about managing Legionella occurrence in a particularly high risk case. And there are recommendations for cleaning and maintaining humidifiers, and not only the whole house humidifiers, but very commonly come for these cool air humidifiers, which is really just creating a spray or aerosol of water and putting that into the air. That can create these small droplets, which might be a risk for Legionella. And so recommending that customers routinely clean and the water basin that the humidifiers are in. And all of these, there are links to authoritative resources, to EPA, CDC, other sites that make these recommendations. The second category of customers we have are those that are in multi-dwelling. So think of larger apartment complexes. Maybe also we encountered that those might also be dormitories, like on if your utility provides water to a university, for example. And in these, the messages for the multi-dwelling are the same as homeowners. And so one advantage of having a website is that you can have hot links back and forth about maintaining shower heads or humidifiers, what have you. But in the multi-dwelling, we start to get other devices that are pretty common. For instance, we might see hot tubs or jacuzzis, pools or shower facilities, might see indoor or outdoor fountains or other types of water features. These type of facilities may have central hot water heaters and distributed lines that need to be maintained. Legionella grows primarily in warm water, so it's primarily a problem in the hot water systems. And if that water is not maintained at an adequate temperature, it can be an environment for which Legionella can grow. Cooling towers and water reservoir tanks, and there's some information on solar water systems as we start to see. Again, these can be features of homeowners, and so they can link between the two. But we might start to see, pools and cooling towers more in multi-dwelling facilities. And then we get to our main focus for risk communication, and that would be the industrial and commercial customers. So these would be not only your businesses, industries, but your commercial customers, what might include hotels. I already mentioned universities, areas where there's a lot of people, for example, airports or other public buildings. And here the guidance emphasizes that that these customers consult the ASHRAE 1888 standard, and there's also a guidance that goes along with that, and we have links on the website to that information. That includes a 7-step program. Because these buildings tend to be more complex, there's just not an easy kind of guidance, and so the guidance, the 7 steps here is to form a team, review the water system, the diagrams, analyze areas that might be prone to Legionella growth, develop control measures, and then monitor and make corrective actions, and then confirm by measuring that the temperature or chlorine residuals are being adequate, and document that. So ASHRAE has a whole program, focused on this. And so for your industrial commercial customers, we want to be pushing them to consulting that and developing essentially a water management plan for their facilities. And then the fourth kind of customer to communicate would be those healthcare facilities, so hospitals, nursing homes, any other location where healthcare is being provided. And here we would refer the customer to the CDC Toolkit. This Toolkit is based on the same ASHRAE standards, so there's a lot of similarity and overlap. There are a few things that are kind of different with a hospital, and that they involved in their water management team would include certified industrial hygienists, microbiologists, and typically hospitals have somebody who's managing the environmental aspect and infection control officer. So those teams look a lot like the commercial buildings, but tend to have a few other specialists that would focus particularly on the healthcare environment. And again, so encouraging your healthcare providers then to be accessing the CDC guidelines. In addition to the web material that is developed, there are a number of supporting pages. These may be included or be optional, depending on your particular focus and your needs of your utilities. But there is additional text that can describe the Legionella ecology, how they grow, what might be the health effects. Certainly on your website, we would recommend that you have a page that talks about your water utility. What are you doing? As Samantha emphasized, we want to talk to the customers that this is a shared responsibility. So the utility is doing their part, and that may be an opportunity to talk about your consumer confidence reports, other types of actions that you are doing in your system, other kind of frequently asked questions, any kind of additional information to show that your utility is meeting and surpassing federal state regulations. As Grace already had mentioned, we have pages on national, international guidelines, links to the CDC toolkit, maybe information on how to disinfect for Legionella. Some of the customers may want to put additional treatment in, questions around Legionella testing, and other plumbing pathogens. And so those questions around the other plumbing pathogens, we have some text there to talk about, well, you're focusing on Legionella, but what about Mycobacterium, Pseudomonas, Aeromonas, and Canthamoeba niglaria? These are other organisms that like Legionella, can grow in building plumbing. And so there's some information on there. For most of these, the actions taken to manage Legionella will also be effective in managing these other plumbing pathogens. And so it's certainly pointing the customer in the right direction for a water management plan. And then the website materials have links to other valuable resources. So the primary focus of this is to make this information available to your customers. And so it directs them to EPA or CDC or other authoritative websites where this information is available. There's a ton of information on Legionella. The utility does not have to compile this yourself. This is readily available. This points your customers to the right direction. On the next couple of slides, I want to show you how this was set up for the project on the American Water website. And at the bottom of the slide, you can see the link. It's also provided on the project website to take a look at. This is only provided for your information, or just kind of one example how this might be arranged. There were constraints in doing this on the American website, because this is kind of their format, their way of organizing their website, and that might be different for your own. So we're not telling you to do it this way, to show you how one utility set it up. So shown on this picture is their landing site. If you went to this amwater.com, the corporate water quality Legionella, they'll take you to this site. It talks about the middle, about a little bit of introduction to Legionella and how this is a shared responsibility. And then there are links to these 4 different customer categories for homeowners, multi-dwelling, commercial, industrial, and healthcare. So the homeowner page, this is very small, and don't expect to read it, but simply shows information I already had talked about. So we have procedures here about maintaining and cleaning shower heads, about managing the hot water and flushing the hot water systems, about humidifiers and other types of devices that might be in a home, including some links to commercial shower filters. Again, this emphasizes the home is typically a low-risk environment, but there may be reasons that customers want to take additional actions. On the multi-dwelling family and apartment homes, again, there's a lot of links to areas where Legionella might be transmitted, for instance, in hot tubs or pools or jacuzzis. CDC has specific guidance on maintenance for these types of devices, so that's a good pointer there, as well as CDC has links on managing pools, and so other cooling towers, other water features, and other types of devices. So this has a lot of links to send those type of customers to authoritative sources. On the industrial commercial, as we said, we're largely emphasizing them to consult the ASHRAE 188 standards. There's a little bit of outline of what that would be entail, so customer kind of has an idea what they're getting into, and there are some links to some other supporting documents that ASHRAE has on providing additional guidance. For hospitals and healthcare, again, it's pointing to the CDC toolbox. It's emphasizing the kind of guidelines that healthcare providers, when healthcare providers should be developing water management plans, and some of the links that CDC has for management and reporting of water management plans. Again, just want to emphasize there's a placeholder for utilities to talk about your shared responsibility on the American Water site. We had links to the consumer confidence reports. We also had frequently asked questions by customers, things that may not be covered in the CCR, as well as environmental programs and activities that watershed protection and other types of activities that customers may find relevant to maintaining water quality in the system. This is very compact. I wanted to show just these other supporting pages. The health effects of Legionellosis, so briefly the types of pneumonia and symptoms, how Legionella grows in water supplies, what might be national and international guidelines, and if a customer had a question around testing and disinfection, there are links to information they could find on that. Here's the page on the other microbes, and you can see, much like we had showed you before, information and links to on other premise plumbing, building plumbing pathogens like Mycobacterium and its related organisms. So after developing, as part of the project and developing these materials, we wanted to test these messages. And so this fit well. In our program was to test the messages, and we wanted to provide this information, make the customers aware of that, and then survey them to find out whether they found this information helpful, was it confusing, did they have additional questions. And so we did this several different ways. One was a phone survey for large customers. We did this in 3 states, an East Coast, West Coast, and the Midwest, just to see if there's any differences in customer attitudes, as well as a mailing of a brochure. We did this in 1 state, and then another survey was done online. This fit well with, at this time, with American Water had a program to reach out to its large customers. So much like Samantha had mentioned, the utility was already reaching out to their large commercial customers, the healthcare providers. It was recognized that your commercial customers may be 20% or so of your total customer base, but frequently they use 50% or more of the water. So it's not a good business practice to ignore communicating with your most important customers. And so there were developed specific customer client people to reach out on a regular basis to these customers, ask them their questions, answer any kind of water issues or water quality issues. And so this program on outreach for Legionella fit very well in that program. Because in fact, after a couple times, there were some customers who, if everything was fine, they didn't have any problems, trying to call them up and have something else to talk about. This was a good opportunity. Hey, we have new information on Legionella. Want to talk to you about water management plans. And so here are the summary of the phone surveys. So we focused on the 3 categories of commercial customers: the multi-dwelling, the commercial industrial, and the hospital healthcare. And we asked them a variety of different questions. But the initial survey was, are you familiar with or have heard of Legionella? And you can see between 70% and 100% of those customers said, yeah, we already know about Legionella. We asked them, are you familiar with the conditions that cause Legionella to grow? And again, overall, almost 77% of the customers were already pretty savvy, not only knowing about Legionella and knowing about their growth. And then we asked them, do you have a building water management plan? And that was specific terminology we used. And you can see between almost 29% up to over 81% of these customers knew what a building water management plan is and said, yeah, we already have one. So this was really interesting that in this survey of customers, it shows that the customers already have a fairly high knowledge of Legionella, heard of that, knew the conditions that cause them to grow, and the majority of them already had a water management plan. That was very encouraging to us as a project team. We really didn't expect responses at this high level. You can see over 80% of the hospitals and healthcare providers already had water management plan, and that's because 2 years ago, the Centers for Medicaid and Medicare made this a requirement for healthcare facilities to potentially could be cut off from funding if they didn't have this water plans to manage Legionella in the water system. And so that reflects a high level of awareness of that. But still, 40% of commercial and industrial customers and multi-dwelling. So that included apartment complexes. Some of these were very large complexes. Commercial included some hotels. And so these customers were already very far down the line. And it's interesting, when we asked them about this, just simply the process of asking them, and then if they didn't know, then the point of this call was to say we have materials on Legionella on our website. we actually called them and then told them we have this information. Can you review that? We'll call you back and again in a week or two and review that with them. And because we wanted to get that feedback of was the information that we were providing useful to them. And overwhelmingly, customers thought that was really helpful. Actually, even before reaching out to our customers, we reached out to our state regulators, environmental protection, or however that's called in your state, and the health department, and reviewed our plans for this project, and reviewed that we were going to contact customers just in case that they happen to call those agencies. And we got very favorable response from our state regulators and health departments. In fact, one said, you have better information on your website than we have on our state website around Legionella. So very encouraging messages. In reaching out to customers, some of the customers who said they didn't have a water management plan said, well, we're going to put that at our next staff meeting, or that we were already thinking about contracting a consultant to develop a management plan for us. So it was a little bit of a boost to move them along in sometimes in plans they already had ongoing. The survey findings by email likewise found a high level of awareness of this issue, particularly in the hospitality and education and higher levels in the healthcare sectors. Still, a large number of these customers considered their contact with their community an important source of information. And we asked them how they prefer email or by phone kind of contact. So hopefully this gives you an idea of how you might be thinking about developing a program for your system. We found that the customers were already aware of Legionella and appreciated the outreach and guidance that was provided from the utilities. They were looking at the utilities as being this authoritative source of information. Contact by the utilities spurred many of them to become more educated and initiate actions to implement building water treatment plans. We recommend the utilities contact their commercial industrial customers personally or by email, whatever your normal outreach program is, with these kinds of messages. And these refute this perception we talked about early on, that outreach to customers might cause undue alarm. In fact, we found that the customers appreciated this collaboration and look for more guidance. So with that, Grace, I'll turn it over to you.
Well, thank you. Thanks to our speakers today for the great presentations. We have a full 30 minutes to have a Q&A sessions. As a reminder, you can submit questions by using the question box. So we'll go ahead and take some time for the question now. So I'm going to give some Mark time to drink some water so he can get some clear his throat. I was just going to start with Sam. Sam, I got questions that utility might be reluctant to communicate about the Legionella to customer because the customer might become concerned about the water quality. Could communicate about the Legionella just be opening a can of worms?
Right. Yeah. I mean, it's interesting, and I hear this from not just water utilities, but all kinds of organizations that are maybe hesitant to talk about things that are complicated or just hard to talk about and might open, like you said, a can of worms. But here's the deal: proactive communication is always better than reactive. Because it gives you the chance as the utility to get the right info out before the information is asked, instead of being caught on the defense and sort of scrambling to answer. So it gives you a chance to get your ducks in a row and also put forth as the authoritative voice the right information. Utilities will be surprised likely to know that more often than not, the proactive approach puts people at ease. It's a message, when you message proactively, people appreciate it. They're more often appreciative than they are concerned when they get info. And actually, this practice of proactive outreach helps build your brand as an entity that your customer can turn to and trust. And then a little bit on the cynical side, it's helpful for you as a utility to have made that effort to proactively reach out and communicate, have a website up to inform your customers about this as a risk, to show or demonstrate that you've made efforts to prepare people for something that is in their control. So there's more reasons to be proactive than reactive.
Well, thank you. Well, there is another question that related to that questions, the question that I just asked. Any tips for the communication barrier that Jen addressed? How would a utility begin to shift approach with the hesitant management and the legal counsels and et cetera, from the completely reactive only to the proactive? Would you like to add some word here?
Yeah, I mean, that's a great question, and there's not a one-size-fits-all approach for every utility in that case, because a lot of that, I have to understand the folks that you need to convince and what are specific concerns in, what's management's posture and previous behavior and concerns, but my advice would be to take small steps and to try some things and see how they work out and then build from there. It's important, in the communicator's role that there's a trusted relationship between management and you. And so that's where some of this can hinge. But there's also research within the communications industry that you can bring to share that will sort of justify and also support the notion that you are much better positioned as a water utility to be proactive with messaging than you are reactive. And I'm happy if people want to reach out to me like directly or separately to continue this conversation. I'm happy to continue that.
Grace, I'll add to that. Really,
sure. Yep.
One of the motivations, this is Mark Bushavai, one of the motivations for being involved in this project is that if you looked at the frequency of Legionella outbreaks, they're now roughly about a third of the waterborne outbreaks every year are due to Legionella. And the feeling, particularly if you're in a medium or large size community, it may be only a matter of time before something occurs in your system. And so rather than waiting until there's a problem in a hospital or nursing home to be proactive, because then they're always going to point questions. Legionella is a waterborne pathogen. How do we know this didn't come from the water system? And there's always kind of questions around that. So, given the frequency of Legionella outbreaks, it is prudent to be proactive in this regard. And that was the main motivation at American Water for being involved in this project.
Okay, great. Oh, since Mark, you answered that question, I got one question. So maybe you may help to answer that question. It's about the reclaimed water. I know you had a project with us, the Legionella in the reclaimed water system. So the question is, we are contemplating using reclaimed waters from our local utility to use for toilet flushing and tower cooling. Are there guidance material for this specifically in managing Legionella?
Yes, well, Grace, as you mentioned, just completed a project published last year, originated in the Water Reuse Research Foundation. Now it's all part of the Water Research Foundation. and you can find that report there. The report specifically did a risk analysis for toilet flushing and cooling towers, and so you can find very detailed guidance in that report and on use of reclaimed water. Certainly, even though the outbreaks of Legionella have been related to drinking water supplies, I'm not aware that there have been any outbreaks related to use of reclaimed water. Various studies have found Legionella in reclaimed water, and so it is prudent to be thinking about that. In Colorado, last year, there was regulations approved for use of reclaimed water for toilet flushing. And so there are a number of states now that have specific regulations on the books. And so that could be helpful if you're thinking about that as well.
Great. Two questions are quite similar. So this question to the Jen. So the question is, some gas company recommend 120 Fahrenheit in hot water heaters for lower costs. That is the ideal gross temperature for the Legionella. How can they be educated on that inappropriate recommendation? That's the one question. And then the second question is, there is inherent conflict in messaging by utility today. Energy utilities are telling the homeowner to reduce their water heater temperatures, while some in water industries are saying the temperature should be increased. How about that? So what kind of message should we give to the homeowner or the customer?
Okay, that's a great question, Grace, and it indicates that there's education that's obviously needed from the energy side and from the customer side on where you should keep your water heater. So one thing that people can do is look at the ASHRAE guidelines and they focus specifically on temperature. I think it's in the CDC documents. It's also in all of the materials that we've talked about today. And so back to 120 Fahrenheit, that is a temperature where Legionella will grow. And you have to balance that against scalding. So when we're talking about setting water heaters, there's a balance between, there's three things. There's the water heater temperature that you need for hot water, not wanting it to be too hot where you would have scalding water coming out at the tap, and then energy savings. So all of the things that have happened around the LEED buildings in the last 20 or so years have focused on saving water and saving energy. And that has probably contributed to some of the problems we're seeing now, because water in buildings is lukewarm, it's stagnant, it's old, and those are all conditions that grow Legionella. So in terms of what the energy company is telling you to save energy, yes, that will save energy, but it could contribute to building water quality problems. So we need to get the message out not only to the group we're talking to today to pass it on to building owners and managers, but there's still a large group of people that we need to communicate with about building water quality and how temperature plays an important role in amplification of Legionella and spread of disease.
Great. Thank you. Well, this question to the Mark or Jen, so why do you think Legionellosis disease is increasing in U.S.?
So this is Mark. There's a lot of speculation. Bottom line is people don't really know. That could be due to increased reporting, increased awareness. It may be that we have an aging population that's more susceptible. It could be that we're having more opportunities for exposure. The reality is it's all of the above and maybe other things that we don't know about. So this is still an area of research and speculation. I said is that the waterborne outbreaks are only a fraction of the total cases. So there may be other exposures in the community, in the environment. So bottom line is that people don't really know.
Okay, thank you. Well, there
Right,
is
and it could be.
Yep. Yeah, go ahead. Yep.
No, Grace, the only thing I would say is it could also be better detection of pneumonia, like what is a cause of pneumonia. And sometimes Legionnaire's disease isn't always tested for when a patient has pneumonia. So there's been a push to do more testing to look at what type of pneumonia is this. So I think it's all the things that Mark said and a host of other things that we probably don't understand at this point.
Right. There's a urine antigen test that can be done, for instance, in a doctor's office. So it's pretty easy. So that may be one of the reasons that there's more monitoring, more awareness for the disease. And so that potentially it could be part of it. People don't think that probably is the total answer. So it's a little bit of a mystery.
Okay. Okay, so this is another future research project idea. So this question to the Samantha. So for public-facing message, why is Legionella being used instead of the Legionnaires disease? Most people, including media, don't speak that way. Would you like to comment on this?
Well, I think both are going to be needed, and there'll be probably an education, even with media folk, on both of those. I think the discrepancy there is whether you're talking about the bacteria that causes the disease, in which case it's Legionella, capital L and italicized, versus the actual condition that someone might experience as a result of inhaling that bacteria, which is Legionnaire's disease. So both are correct. It just depends on whether you're talking about the bacteria itself or the disease that someone can incur.
Okay. The next question is to maybe the Mark or Jen. Are there any national guidelines in the work for the routine water testing of the Legionella?
Not that I know about.
Yeah, that's a good question, and I think that's a problem. There are no guidelines from EPA or CDC at the moment. The ASHRAE standard leaves that up to the water management team to determine whether they need to do any kind of testing to validate the management plan. There are some guidelines, as we point here, international and national. The Association of Industrial Hygienists have some guidelines. Again, these don't carry any kind of regulatory authority, but if you're looking for kind of benchmarks for just looking at concentrations or frequency of detections, but right now this is a void, and something that in the last webcast that we had for Legionella on Legionella in December, I think that's a problem. I think that's holding people back from being more proactive in monitoring either for utilities, monitor the water system, or for building owners to monitor their building because they're afraid of what they'll find. 0 is a great number, but anything other than that could be a problem. I think there is research and information that's available that we could develop some kind of public health guidance. It doesn't necessarily have to be regulations at this point, but some kind of guidelines that allow people to do some monitoring and in response to that. And in particular, there's a paper that's accepted for publication, but it's not yet out, that has developed some quantitative microbial risk assessments of Legionella in showering and in faucets and toilets and in cooling systems that would be helpful. So I think as we're moving forward, we don't have it today. We may not even see it, later this year. But I think we're probably not too far off in the distance of having, some kind of a guidance. And a paper that was published in the journal just this last month, there are some guidelines, protocols for responding to positive samples, repeat sampling, and doing some serotype analysis. It isn't quite the numerical guidelines, but we're starting to move the ball down the road to provide some kind of benchmark or framework or understanding of what different levels of and frequency of occurrence of different levels of Legionella might mean, but we're not there yet today.
Okay. All right. Well, as I mentioned in the beginning of the webcast, we posted the 1 pages of the fact sheets on the compiled national international guidelines for the Legionella control that come out from this project report. So feel free to access our website and then download as needed. There is one question is also again related to the previous question that I asked to you. So there is a standard and a guideline for the acceptable level of Legionella in the plumbing system.
Yeah, I think Grace, just what we said. No, they're not. Yep. They're not. Well, there are standards and guidelines international. There isn't. If we're looking for regulations or guidance, not in the U.S. I think the EU guidance, and so if you can go back to the December webcast that's presented, I think is a useful framework, but we're not there yet in the United States. So, so there are no standards yet.
Okay. Well, the next question to again Jen or Mark. Do you have information on the effectiveness of a management plan at controlling Legionella in plumbing system?
So,
Jen, you want to take a crack at that? I can't answer that, but go ahead.
Sure. I mean, the CDC has said for several years now that, in their opinion, having a building water management plan is a very effective way to control Legionella, and that buildings that have management plans in place will be able to, prevent disease within the building. Certainly within my experience, having been working in that for the last probably 3 years now and developing water management plans, in many of the buildings I've worked with, they haven't necessarily had outbreaks or cases of Legionnaire's disease. They may have had occurrence of Legionella in the water. And certainly when you follow that 7-step protocol that Mark mentioned during the presentation, which is the steps to the kind of recognized steps of developing a water management plan, you see improvements in water quality, and the things that we're trying to do to improve water quality, things like increasing flow, making sure that we don't have high water age, keeping the residual high, managing the temperature. All of those things together will improve the microbiology and the chemistry of the water and control opportunistic pathogens. So certainly in my practice, I have absolutely seen that the plans are effective in maintaining water quality.
Good answer, ditto. That's exactly what I was going to say.
Okay, great. There is one question about the website. So does the website discussions of the potential on-site treatment also discuss the fact that such a treatment could cause the facility to become a regulated water supply system?
Yeah, it's a good.
Yep.
Yeah, so that's a good question. Well, it doesn't talk about. Well, it would refer them to ASHRAE, and ASHRAE does bring that up if potential for treatment is on if a building implements treatment, it could trigger them to undergo additional regulations. This is something that is being looked at now to try to provide some guidance to the states. Some states may already have some guidance. Many states don't or are unsure how to move forward. But But yeah, so if they put on a disinfectant, for example, or chlorine, that may trigger additional regulations.
Okay. There is question about the misting system. So, are the misting systems such as you can find on the street corner of the city, like Las Vegas, is a concern for the Legionella?
Yes, this is Jen, they potentially could be, because if there's Legionella that's growing in that water and it's being misted out into aerosols, those are the types of aerosols that could be inhaled. So they certainly could be a potential source of infection depending on the water quality of the water that's forming that mist.
Okay, thank you. Well, there is one question that I can answer. So where will these resource documents be available to utility for use? So this project or resources, or you can download it from the foundation website and type in the project number 4664, and then you can download as free. So other questions. So what is the drinking water contribution to the total Legionella cases?
This is Mark. It's a good question. It's not known. The conditions for most drinking water systems, and certainly if they're in compliance with regulations. So if you're a surface water support system and you're meeting surface water treatment rule and the LT1 and LT2 consequences, and you're maintaining a disinfectant residual in your system, then the risk in the drinking water distribution system is low. That being said, there have been cases. I point to one outbreak in New Jersey where it was traced to a storage tank that didn't maintain a disinfectant residual, and Legionella was found in the sediments of that tank, and that was serving directly, I think, nursing home that had the outbreak. So it's important that, in this shared responsibility that we're talking about, it's important that water utilities certainly do all the things that utilities do now to maintain water quality in their distribution system. So good turnovers in tanks, maintain the disinfectant residual, reduce the water age, routinely flush their systems to remove accumulated sediments and debris. That being said, the risks from Legionella in drinking water systems would be considered low, because it really takes that amplification of Legionella to grow to fairly high levels, and then the aerosolization of that to cause disease. And so drinking water systems now that are properly treated and maintain a disinfectant residual are low at risk. This is an ongoing area of work. I think as we get guidelines that allow utilities to do monitoring, they can validate for themselves what they're doing now is adequate to control, manage low levels of Legionella in the water. It won't be, drinking water is not sterile, and we certainly can find Legionella at low frequencies of occurrence, even in properly treated water, but that doesn't grow to high levels to which, where Legionnaire's disease occurs. So it's needing to manage the quality of the water in the water distribution system and in the building plumbing, together to reduce the risk of infection from Legionnaire's disease.
So there is also another interesting question. What do we say to those who said just add more chlorine? So what should we say to those kind of folks? Have any comments?
Well, Grace, I'll jump in on this one. Adding more chlorine, I don't know if that means adding more chlorine in distribution. So, for example, requiring a higher residual, having the state mandate, something beyond detectable, maybe 0.1, 0.2, 0.5. Certainly, in my experience, that with buildings is it really comes down to the building. One of the things we always look at is the influent water quality parameters, including chlorine, and then what we see in the building. And we generally see high levels, whatever the utility is putting out. So I give you some examples of, 1.5 to 1.6 milligrams per liter in a chloraminated system in California. Very consistent going into that building. But because of the way the building water quality is managed, by the time it even got to the water heaters, there was no detectable residual because they had upstream softening. They also had a very large storage tank that had nitrified. So what, in my experience, you want to have good residual in the system. You want it to be protective generally, for bacteria and viruses. But once it gets into the building, and I said that in my set of slides, the building exerts its own ecosystem control on that water. So if you've got to have a good residual coming in, but the answer to controlling Legionnaire's disease doesn't lie with mandating higher chlorine residual for drinking water utilities. Because if the water quality degrades in that building, whether it's coming in at 1.5 or it's coming in at 0.5, if that degradation occurs in the building, it doesn't matter that you had a high residual in the distribution system.
Okay, great. Thank you. There is a question about the ice machine. So the ice machine, there is a question, what about the ice machine? University of Pittsburgh said patient drinking the ice waters, which has a Legionella, is a problem if they aspirate. Recently, in one sample program, and 2 ice machines in healthcare facilities were targeted, and both had Legionella. Ice machines are also in hotel and restaurants and other big buildings. What's your thoughts?
Well, ice machines would be included as part of that water management plan in a facility. So, so just one example where water is used and exposed, and so there, a water management plan, and particularly an infection control plan in a hospital, would look at cleaning and of ice in the ice machines. Legionella can survive freezing and can be present, and so where the ice is made, it's a potential where before it's freezing, Legionella might be trapped in the water system. Again, I don't know. I mean, I think that's kind of theoretical that Legionella from ice could be aspirated. There's some questions exactly what the role is. We've kind of been in contact, particularly through the National Academy of Panel. But still, we want to make sure that all in a water management plan, all the uses of water would be identified and properly managed and cleaned. So certainly, ice machines would be fall under that plan, whether it is covered in a water management plan for a hospital, a healthcare facility, or a hotel, or other type of facility.
Okay. Well, other questions. Do you think more recent data on the colonizations of the shower holes indicate that they should be included in the risk management? If so, what strategy would you recommend for the mitigation, particularly for the residential use? Any comments?
Well, again, so this is Mark. Again, in residential use, because of the plumbing in a house is not as complicated in a big building, and that the chlorine residual that's provided at the meter more likely penetrates a house. unless the house has kind of a whole house filter like a GAC, which I would not recommend because it's taking the chlorine out, and then you have no residual managing bacterial growth in the rest of the building plumbing. So, again, we want to emphasize that the evidence, outbreak evidence and risk evidence for homeowners is that this risk is low, but we can't say that it's, exactly how low or depending on the types of at-risk people that might be living there may be pertinent. And so that flexible hose on the shower has been shown to, because it's a flexible kind of a plastic hose, can support bacterial growth of a variety of different bacteria, including Legionella. As long as that water in that hose is having a disinfectant residual, that will be effective for managing Legionella, high levels of Legionella growth. But if that's particularly, if you have a susceptible individual, maybe having a shower without that flexible hose would be recommended, or it can be periodically changed out and cleaned. I don't recall whether on the website there's information that particularly targets that flexible hose. Its role in Legionella growth is known, but anyway, there'd be procedures to clean and manage any type of biofilm that would be growing in a flexible hose.
Okay. Well, thank you. Well, it's already 1 minute past, so we have to stop in a Q&A sessions here. As mentioned, that this slide and the recording of this webcast will be available on the foundation website. The questions that we could not answer during the webcast will be answered by email. And I would like to thank each of the speakers who are willing to present and share their knowledge with the audience. And thank you for joining the webcast today. And please do complete the follow-up survey. And once again, thank you and enjoy the rest of your day.